Hi, my name is Dr. Charlie Cage, and welcome to the Build Up Podcast. This is a space where we talk all about wellness, lifestyle, and of course, dentistry. Today, I would love to introduce to you my guest, Dr. Jenny Giao.
Hi, Dr. Cage. Thanks for having me here today.
I'm so happy you're here. I thought it was really important to have Jenny here on the show so that she can talk to us about her experience, both as a dentist and a naval officer. So tell me about yourself.
Sure, I'd love to. So thanks so much again for having me today. I think this is an awesome initiative to open a space for dentists and naval officers or anyone who's interested in wellness to listen about wellness and kind of take some advice into their own habits. So a little bit about me was I was born and raised in Frankfurt, Germany. I lived there until I was about 6 years old, and then my family and we moved to the U.S. We are a traditional Vietnamese American household, but because we grew up a lot of our years in Germany, we have a little bit of German roots to ourselves as well. So I'm thankful that I came from like a very culturally vibrant home.
I think that's really amazing.
Thanks. Yeah. And then for my undergraduate education, I studied at UC Davis and I got a degree in neurology and physiology. And then I graduated dental school from UCSF School of Dentistry in 2022. And that's where we met shortly after that. My first duty station in the Navy was San Diego, and I've been working as a general dentist and naval officer there.
Okay, that sounds all amazing, and you sound like an incredibly smart person.
Thank you.
So I know it sounds like you've had to have a lot of schooling, a lot of education. How did you incorporate wellness into your education?
That's a great question. I think wellness is a lifelong practice, and it's something that I'm noticing is more important each day as I take steps into my career to prioritize and hone. For me and my students and the people that I went to school with, we were in the era of COVID, so a time where mental wellness, I think, went at an all-time low. We also have so many student loans and so many different pressures around us to succeed as dentists and also to have a fulfilling personal life. And so for me, I've really been trying to prioritize wellness and make sure that I am able to enjoy the profession of dentistry, but making it a priority to make it sustainable and long-lasting to me.
Yes, I think that sounds all amazing.
Harder than it sounds.
Absolutely. But it's just one of those things where if it was easy, everyone would do it.
I agree.
Right?
Yeah.
And so at what time did you think you realized the importance of wellness?
I would say it was definitely within the last year. I think when we are in the thick of going to college, going to dental school, going through these very organized hoops that we must jump over to get to the next step, even if we are feeling like we're not taking the best care of ourselves, like we are missing meals or not getting as much sleep because we're studying or we're in sim lab, I always thought like this was a part of the hustle to get to where we would want to go, because like you said, if it was easy, everyone would do it.
Absolutely.
But I realized that overworking and hustle culture will really take an effect on your body, and that has been becoming so apparent to me in just 1 year of practicing as a general dentist. And so when I come home and I'm feeling like tension in my neck and in my shoulders, or I just feel that I don't have as much energy as I would like to for my friends and family, that is when I noticed I really wanted to assess where my priorities are, where I'm allocating my energy, and how I can try and live maybe just like a mindset and a life with a little bit more harmony so that I can give attention to the things that I care about in life.
Mm-hmm. It's definitely a mindset shift and not something that we were taught in dental school.
Yeah, and it's like for over all of our years of education and training, we're just told to go, 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 and then no one tells you to stop or to reassess, and it's a really important self-assessment to make.
It really is. But unlike everything that you've learned to become a dentist, you weren't taught how to be well.
No.
So
in fact, unwell.
Right?
Yeah.
So what are some things that you've done in the past year since you've identified that you needed that mindset shift? What have you done to learn? Like, what resources would you recommend to our listeners today who might be able to identify with you and want to make that shift too?
That is a really great question, Dr. Cage. I would say, even though I'm trying these modifications and adjustments to my life now, I wouldn't wait until you're a year or two in practice to start this. I think if you are in college or you're in dental school or you're anywhere along that path and you are feeling stressed and overworked, but you want to make a good, meaningful impact to your community, wherever you are, it's just never too early to start. And some things that I've been doing, and they sound silly, but I've just been working on implementing more rigid boundaries in my working day and my lifestyle. So in dental school, it's kind of hilarious looking at it now, but they would give us 3 hours to do one filling.
Yes, it seemed like such a short amount of time.
Yeah, and I would be like, oh my gosh, I have to don and doff my PPE and wipe my loops, and if I have to pee during that time, I can't afford to lose those probably 30 seconds of time to dismiss myself and use the bathroom. So I'm just going to hold it. But then I finish my filling and I'm racing to find my faculty to swipe my note, and then I hold it again, and then I work through lunch, and it's just this really predictable cycle that my body gets used to, that now looking at it, I'm like, this is an unacceptable way for us to be treating ourselves, especially when we want to be in a healthy position to be able to take care of other people. And so now if I even feel the urgency to have to get a sip of water, to have lunch, to use the bathroom, I give myself that, and I tell myself that you're not being lazy, you're not slacking, you are just being human.
Yes.
And every working employee gets to have a lunch break, and that's not something we should like be prideful of, like, oh, I worked through lunch today, so I'm on top, because it's really hard on your body if your first meal of the day is at 6 p.m. after traffic driving home.
Yeah. I always have my favorite book here, The Best Yes.
Cool.
And so it talks about boundaries, right? And making decisions that will best suit you and your needs. And I think the only person who can really write that priority list, that only person is you. And oftentimes, whether it's school or our work, or even sometimes with our family, they try to make that list according to their needs. But it's really important for us to sit down and evaluate things based solely on the things that are important to us, right? So when I look at culture as a whole, understanding that I also did not grow up in the United States, the culture here is different.
Yeah.
And now that I have children, I also see how this hustle culture is not just in dental school or even in college, but is also down the line into middle school, right? I'm seeing young kids going to school, having all these after school activities, and come home, have to do homework, immediately go to sleep, and turn around and they have to do it all again. So we're creating this culture of toxic work ethic that is now being taught to the youngest of kids.
Yeah, when they should have the freedom to just
Be
curious,
kids.
be kids. Yeah, that's so crazy.
It is.
It's like the only time where you can really be curious and have your own time is retirement, which I'm just going to be too banged up by then to...
But that's not what we want.
That's not the goal.
Yes.
I agree, yeah.
So it's always this concept of when I blank, I will be happy. And I'm sure you thought of that too. When I become a dentist, I'll be happy. And now you're telling me that you're now identifying how the way that you function on a daily basis is actually hurting your mental wellness. So you're doing things such as creating boundaries. And what are the things are you implementing? Are you reading any books? Are you doing any self-care routines that help with that?
Yeah, that's also a really good follow-up question. So in addition to setting boundaries, I found one thing that's helpful is having maybe just less than a handful of people that you share or verbalize these boundaries with that maybe also are trying to make improvements in their lifestyle. Because I find that when, like I tell my husband, for example, like, oh, babe, I'm trying to drink 3 bottles of water today by the time I get home, or I want to make sure I have my 30-minute lunch break. When we talk at the end of the day, he'll say, hey, did you do that? And if I didn't, I'm like, oh, crap, I already know he's going to ask me. I better do something. And I know you're like that at work, too. I've seen it.
Yes.
Yeah, so I think sharing with people your goals and having them support you, even if they're just checking in on you, and then you can offer that reciprocally, like saying, how was school for you today? Did you get what you needed to take care of yourself as well?
Yes.
In addition, I think you're also very familiar with this resource, but I'm a big fan of the 5-minute journal. It's on Amazon. You can just buy it wherever, but it's a really cute aesthetic little book. I think you have it around.
It's actually right here.
Wow.
Right here.
So this book is excellent because for someone, I used to try journaling, and I would say my mind thinks too fast, like faster than I can write my thoughts.
Mm-hmm.
And so I would tell my therapist, like, journaling's too annoying because I think faster than I can write. And then my therapist says, that's exactly why you need to journal. You need to calm your thoughts. You need to unwind and have that as part of your routine. And the reason I really like the gratitude journal is because the prompts are very short. They are, what are you grateful for today? What are 3 things that would make your tomorrow excellent?
Mm-hmm.
What have you learned today? And I think that they are very reproducible prompts that don't take a massive amount of mental energy to complete. And then they are in like small doses where making that habit and doing it every day is reasonable. And even when I have a bad day and I'm like, I have to fill out this blank line of what went well today, I will find something, even if it was just like the blueberries that I had in my yogurt were extra sweet and I'm thankful for having fresh produce.
I mean, it's just the simple things.
Mm-hmm.
So oftentimes on Instagram, we'll see all these elaborate things that people do, to incorporate wellness into their daily lives, whether it's, going out to fancy restaurants or getting this expensive, skincare tool. But it really is just the simple things and finding happiness in the things that you have right now. It doesn't have to cost anything, but it's just your daily interactions that if you have that mindset shift, you can find a lot of happiness from it.
Yeah. I think one challenging aspect of wellness is that you have to hold yourself to making that habit. No one is ever going to hand you positive mindset, excellent wellness on a platter. And it's something that we have to practice, and it's something that we have to nurture.
Yes.
And we've had conversations about this before. Sometimes it's not even about like, I'm cured, I'm never stressed, I'm never anxious.
No.
It obviously doesn't work like that. But just even seeing like, 6 months ago, I used to really stay up late at night thinking about how this one piece of dentistry could have been slightly better, and I'm mad that I didn't do it.
Yes.
Today, I think, you know what? I tried my best. This was clinically acceptable. It's going to last the patient a long time. And here's one way I could improve the next time.
Yeah. So I'm reading a book right now that's The Atomic Habits, and it talks about making small changes in your life and not making it so overwhelming that you can't make that change and stick to that habit, and also tagging that new change that you want to something that you always do. So with the gratitude journaling, even if it's just 5 minutes, I think anyone can journal for 5 minutes. It's quite easy. And one thing that makes it a bit easier are the prompts. It helps to just remove some of that resistance that can prevent you from continuing with that habit.
Yeah.
And so tagging it along with something that you normally do, maybe something that you always like to do, like in the evening, you might have a glass of wine. You can say, before I have my glass of wine, I'm going to journal for my 5 minutes. Or before you have your cup of tea, journal for your 5 minutes. But it's something that if we can tag something for just that short amount of time to something that we already like doing and we keep up with it, we can really start to appreciate how much change it can make in our lives.
Yeah, it's kind of crazy because as dentists, we are so detail-oriented and critical of ourselves. And this book, or the gratitude journal, I feel like it's actually inceptioning my brain to make myself ask, what's one good thing that happened today? Because if I didn't have that, I wouldn't naturally in my like Rolodex of my thoughts every day ask myself that and have to think of a response. But over time, I'm hopeful that some of my thought processes will kind of shift into a more positive mindset because I'm slowly integrating these questions in my journaling.
Right. Even if it's slow, it's still progress. And that's all we try to do every single day. So you mentioned in your journaling, your mind would just continue to go. Do you find it difficult for you to sit, relax, and not do anything?
Yeah, I hate it. I'm so bad. I would rather have a to-do list or like fill my Google Calendar from 6 a.m. to 8 p.m. and have something that I like, oh, I need to go FaceTime with a friend. I need to clean my car. I need to do whatever errands than just sit in nothingness, because I'm so uncomfortable doing nothing because my brain is just always running like crazy.
Just always going.
Yeah.
That's hard. Do you think you can get to a point where you can sit in silence?
I'm going to try. Actually, this is kind of funny. One time I was like, okay, Jenny, try. So I pulled up a really nice like 10-minute meditation video on YouTube. And this is like a really toxic trait revealed, but I changed it to 2 times speed.
Oh.
So that I could be done with it in 5 minutes, because I just want to finish tasks and go to the next thing. But that goes against the entire purpose of it, I know.
But you identify it.
I do.
Right? And I
Yeah.
think that's something that most people can't even get to. That's why I feel so happy for you that this is only the first year of you being a dentist and identifying that you need to have that shift in your life. And even though you are making steps towards improvement and you're like, oh, maybe I could have done better in this or that, you're still giving yourself some grace and some room for improvement.
Yeah.
Because like you said, we're not perfect, but being able to see what ways that you can improve, I think that's where it starts.
Yeah.
And then we just go from there. Yeah.
Yeah.
That's all we can do. So now that you have completed your first year as a dentist, what wellness tips or advice would you give to someone who is a new dentist?
Ooh, one piece of advice that I would love to have had last year is that, okay, so when we graduate dental school, we still have some like protected innocence of our professional identity. Like we do our 10 crowns or 50 fillings and we're like, all right, ready to rock and roll. Then you go and you make decisions by yourself as a dentist, and you start to realize like, wait, even though, yes, I did all of these steps to graduate dental school, I took all of my licensure exams, I actually only know maybe 20-30% of dentistry. I don't know, that number might be generous. You can tell me because you're an AGD director.
Might be generous.
Okay, sorry. And so for me, I think it's like, I would love to share the message that you must have grace with yourself as you are a new dentist and making decisions. And you should use all of your resources. If you're in an AGD or GPR program, like look to your mentors. If you're out in private practice working, like get connected with some other dentists through CE courses or just through like local dental societies, because I started feeling better when I talked to my friends and I realized we all feel this way. And it's just a really arduous learning curve that we certainly signed up for, so we're going to take it. But I would love for new dentists to try their best each day, make maybe like short tangible goals of how they will improve in dentistry, but then also give them the grace when something is not perfection.
Absolutely. So I've been practicing for over 10 years now, and I think I might know 40% of dentistry.
That's so crazy, because when I look at you practicing, I'm like, you are the book and beyond.
No.
Like your brain is dentistry.
Not at all. I think that's one of the things too that I struggled with, because I want to know everything. I want to be the best. I want to know everything out there when it comes to dentistry. But when you look at all the different specialties, it would be hard to know everything.
Yeah.
Right? So even in my specialty, I know that my knowledge still isn't 100%. And so the progress that I've made when it comes to my own wellness is understanding that that's okay. I'm okay with that.
Yeah.
And it's almost exciting to know that there's still so much that I can learn and I can improve. So you can also just kind of narrow down in your own niche or niche of what you like to do in dentistry and really excel at that. But where it really is fun and exciting is moving outside of that comfort zone. So
yeah, I think right now clinically I'm like trying to build my bread and butter niche, and then as I get more comfortable with it, like certain implant cases we're working on together, I want to expand that and then hopefully gain more confidence to treat patients comprehensively.
yeah, it's fun.
So thank you for all your questions that you've asked me so far. I think it's a great conversation for anyone that is looking to pursue dentistry or someone that is getting ready soon to practice dentistry themselves to consider. I'd like to ask you one question in return. What would you tell your young dentist self 10 years ago that you didn't know?
Oh, that's a great question. Looking back, 10 plus years, geez. I think I would tell the younger version of myself that it will all work out and that we'll be okay, that we're safe, and that my hard work would pay off. I think that I didn't necessarily have to change my work ethic and how I did things, but my mental health wouldn't have to be as compromised. Today, I suffer from chronic pain disorders, and I feel like if I had that sense of security back then, I don't think that I would be in the position that I'm in today. It's one of those slippery slope things, though, where you try to go back and look in the past and say, if I this, then I would have done this differently. But while it can be used as a learning experience, it's also not a place that I like to go mentally, knowing that it's in the past.
You cannot change it.
I can't change it.
Right.
And maybe some of those things made me who I am today.
Yeah.
I don't know. Maybe if I had things differently, I wouldn't be able to, really develop my own mental wellness today and try to embrace that part of life. I don't know.
Yeah.
But I think looking back at that younger version of myself, I do look at her with a bit more grace and less anger than I think I would have before I started my wellness journey.
I think that's so important because I see you prioritizing your wellness now and then being an advocate for just helping people live a more balanced lifestyle.
Yes.
And yeah, maybe if you didn't go through all of that, the way you would practice dentistry, the way you would be a wife and a mother, perhaps a totally different outlook and perspective.
Absolutely. So it's one of the things that I always journal about when it comes to my gratitude, is saying that I'm grateful for the things that I've gone through, whether they're good or they're bad, because they made me who I am. And I think today I'm a pretty awesome person.
Yeah.
And it's not something.
I think so.
Thank you. It's not something that I would have been able to say to myself or even out loud. I think being especially a woman in dentistry, in a male-dominated field, as a woman, we tend to downplay everything that we do, our accomplishments, who we are. And I would not have said that about myself a few years back. So again, progress.
Yeah, that actually just like puts truly a big smile on my face, and it's something that I want to work towards too. So I think although we are colleagues, you are also a really big role model of mine. And I like that we're doing this because I hope that we can share this message with other people, and that others can...
I'm not going to cry.
Do not. And others can lead with better wellness, and hopefully our profession improves, our burnout rates decrease, and we can just learn to provide a better service because we're happy within ourselves.
Yeah. And we can't wait for somebody else to start making those decisions for us.
And we can't wait till retirement.
No, we definitely can't wait for that. It starts now, and it starts with you. It starts with me, right? So today, moving forward, new changes.
Yeah, and that's the buildup.
Yes, it is. Well, thank you so much for joining us today, guys. Be sure to leave us a comment if you're watching this on the video podcast, and make sure you leave us a 5-star review.
Smash that like and subscribe button is what they
What
say
they
online.
say,
Yeah.
what they say nowadays. But definitely share your experience with us. We'd love to hear your story, and if it's okay with you, we'd love to share it here too, because we often refuse to share our story because we feel like we're alone in this struggle. And I want everyone out there to know that they are not alone. You share your story so other people can hear it and be able to identify and learn from it as well. So thank you, and see you next time.
Thanks for having me.